Dr. Mekuru mentioned it. In other countries, they have a similar system, but the village health teams or community health workers are facilitated. In Uganda, we're saying they should volunteer.
Okay, I think they're called volunteer health teams.
They are volunteer health teams.
Yeah.
Now, how are you going to volunteer every day in the middle of the night? You are taking a woman to the, it becomes difficult. So to me, my question, my issue here is that shouldn't government pay a certain stipend, some little money, for the village health teams to be motivated to support our community?
No, you don't. I think you might not pay them really, but what you need to do, I think, would be to, for instance, if you brought in the model where you have midwives, you look at traditional midwives whose role is to beef up the village health teams. So the midwives will be paid a salary to do the work, moving up and down, but together with the village health teams. And you know that one will bring in an addition, because it might be difficult for you to start paying the village health teams and all that. But if you brought, because you see the one of the disadvantages we have with our village health teams, they are good, but they are not as competent as if you added on a midwife. And that's why Sri Lanka beat us, because what Sri Lanka did, for them they used the same concept, but instead of having a village health team, for them they employed a midwife who is resident in the village. So this brought a lot of value.
But in Ethiopia, it has actually worked better. They support the community of workers. But coming back to the question of the caller is that if we can have mothers supported in a community and connected to the health facility, the nearest, it can be a center 2, a center 3, depending on where they are. If you can have that link, I think it will be helpful, and also to follow them up. Because most mothers come and deliver babies in a hospital, they go back to the communities and they can't, and you find what you call the babies die, and because of lack of follow-up. So to me, once we strengthen that system, it would lead to better results.
Dr. Jessica, do all the stakeholders understand how the system is supposed to work? Because you might have a system on paper that is not being implemented. Does everyone involved know what their role is supposed to be in the system?
I think the health sector is one of the only sectors which has a well-defined structure and system up to the grassroots. We have health center from the hospital up to health center 1.
Down to
center 1. And the village health team is referring to is what we call a health center 1. It's well articulated with different standards for each level and what should happen. And concerning the issue of referral, actually that's the big problem, as we mentioned earlier on. The policy in the country, we don't promote traditional birth attendants. We have actually phased them out. In the old days, we used to train them, but evidence showed that actually they were not as effective as we thought. So for a traditional birth attendant to be effective, you need to be trained, well trained. In Ethiopia, they train them for more than 1 year. You need to be supervised, you need to be equipped. So the traditional birth attendants we have now in the communities are not recognized. They're actually illegal, and because people go there for a number of reasons, as I mentioned earlier on, they actually become a risk. As I said, they tend to delay these mothers, and normally because they have also an economic benefit out of it, they tend to keep these mothers for a bit longer. And by the time they have given up and they have failed and refer them to our hands, it's too late.
Too late to do anything about it.
So, but we have also trying to see, we also know that they exist. And we also know that in some places like Karamoja, where there's very low staffing, they may exist. And in some situations, actually, they've tried to link them to the health unit.
I was going to ask whether
as part of the village health team,
actually incorporate them into the system.
So that they can identify these mothers, engage them, and bring them to the health unit. We are willing to work with them in the health system, but as long as they are well supervised and their role is well defined, and they don't go beyond the scope of the recommendation, the government recommendation.
While we are at that, before we go back to the phone lines and take another few phone calls, we had Jaffa who was calling and asking something very interesting
male midwives.
About male midwives and the fact that the majority of women will have a big problem being attended to by male birth attendants.
The issue of male midwives, I think, has started coming up recent, but traditionally in the Ugandan health system, we don't train male midwives. Most of our midwives are actually female. But we have another training called a comprehensive nurse midwife. And that's where we tend to have some males also who deliver mothers. But actually experience has shown outside there is that what a mother really wants is a polite, a kind, a forthcoming health worker. And many mothers actually say they don't mind even having a male midwife deliver them. And where they have been, especially in the rural areas, most people appreciate the male midwives. When it comes to religion, then that's a different thing altogether. And I know in many countries, Muslim countries also they have those. But then we have an option because most of our midwives are actually female. Unfortunately, we don't have enough midwives to spread around the country. And that has been one of the key priorities we're trying to focus on, to increase the workforce and ensure that we can actually increase the midwives, who are mostly females. But we do have some male midwives, and they've done very well. And where they are working, they become very popular, and people like them. But if you had a choice, if you had more midwives, that wouldn't be a problem, because then people would be allowed, you'd go to the same facility, and you can choose to have a male midwife or a female midwife. The main issue is staffing. Which
in a way goes back to what I think what Dr. Jamoki and Dr. Mwangi were saying earlier on. You need the money to be able to hire these people, and it's something that we'll touch on when we get to the point of how do we move forward and how do we solve this problem. Let's take another few of your phone calls. If you want to be a part of our discussion, the phone lines are on the screen. You can give us a call. Tell us where you're calling from, your name, and of course try to limit your question or comment to 30 seconds. Hello, welcome to NTV. I think we lost that call. We'll go on to the next one. Thank you for watching NTV.
Hello.
Welcome to the show. Hello.
How are you?
We're fine, thank you. Please tell us your name and where you're calling from.
How are you? Now, my question is, or a comment for that matter. You know, much as we want the government to sink a little more money into health, the question comes, how are we using the resource? Facilities, 1, 2, drugs, stuff we have. How have we used it effectively and efficiently to serve the people? I'll give you an example which I read today in the Monitor. Where a mother came from the island in Munjako. She traveled all the way, went to some hospital. Then when she reached there, the nurses locked themselves out in the room. They refused to come out. Not until one person who knew, a journalist who writes for Monitor, that journalist then called Kaihura. Kaihura was not, okay, we were on phone, but was not speaking. Then he called Andrew Kawesi. It was Andrew Kawesi who called another police post that time. Which police post again sent whatever. A car, which then the car picked that lady to another hospital, and this is how the lady was helped. So the personnel are there, but they are not doing what they are supposed to do. This woman had delivered a first kid in the island. The second kid had refused to come out, and had it not been that intervention, this lady was not going to die. But should people first call police for people to be helped?
Thank you.
That is one, too.
Thank you very much. We'll move on to another few phone calls, but your point is very well taken. I think it's a very interesting story. Let's take just 2 more phone calls before we get back to the discussion here. Hello, welcome to NTV.
This is Bella calling.
Yes, Bella.
The problem I've identified is there is a lot of corruption in the medical sector. If you want to go to the labor ward in the late hours, like at 8 a.m., in hospitals, there is no medicine, and for someone to work on you have to pay something to that person, private or government. So they need to work on supervision of labor ward to avoid maternal death. Thank you.
Thank you very much, Bella. We'll leave it at that for the phone calls. Interesting things that are being raised here. The corruption bit, which no one ever wants to talk about in this country for one reason or another. But the way we think about corruption normally is that it's, the people at the higher levels who are stealing millions and billions of shillings of money. But what Bella is raising is actually down to the very grassroots level, where you've got a midwife who says, I'm not going to attend to you unless you give me 8,000 shillings. How do we get rid of that problem? Because again, their argument would be, and it's almost understandable, that look, the government is paying me 100,000 shillings a month, which I'm not being paid for 3 months in a row. How am I supposed to survive? I think that's their thinking, isn't it? Yeah. How do we fix that?
Yeah, first of all, just to apologize and to mention to the public that we do condemn negligence, and our oath actually doesn't promote that. And we are sorry for some of these cases which have come out. But I think, as earlier mentioned by Dr. Mwangi, some of these situations, when we studied them, they are because of lack of the whole system being functional. You have a health worker who is not accommodated. She's sleeping somewhere, the house is not lit. We've seen mothers, health workers fearing to come and deliver because there's no light in the health system, or that there's no ambulance to refer this mother. The salary, as you said, is very poor. So again, there are some issues we have trying to fix in the system, and also which need resources. Some people have done mistakes as individuals, and we've actually penalized them. But some of the situations we have found that actually there are systems which need to be strengthened, and which takes us back to the whole issue we've been discussing all over here. But data has shown, evidence has shown that actually the situation is improving. Most of the health units actually have now drugs. Medicines are available there. The challenge we have is staffing. In some places, actually, drugs are expiring because there's nobody to prescribe them. And also, sometimes the community is not aware. But the situation of the medicine, we tend to see from our supervision reports and so on, that I think that things are improving. Again, the health worker issue is not only limited to the lower level. Even the higher levels for supervision, we have a challenge there. Again, staffing has been a big problem. But government has taken a bold step with